we wanted to evaluate the association between parental smoking and multiple sclerosis because active smoking is a known risk factor for multiple sclerosis and also a prognostic factor. Also, passive smoke exposure has been suggested as a risk factor for multiple sclerosis. Instead, parental smoking has been little studied and with conflicting results. We used the data collected by the EnvIMS study, which is a large multinational case control study. It was designed to evaluate past environmental exposure and also lifestyle characteristics potentially influencing multiple sclerosis risk. We included 3 different populations: Italian, Norwegian, and Canadian. Inclusion criteria were a diagnosis of MS according to maternal criteria of 2001, age of 18 years old or older, and MS onset within 10 years prior to study time. The results, we found that among Norwegians, maternal smoking during pregnancy was associated with multiple sclerosis after the adjustment for index age and smoking habit. And when we then stratified by sex. And after the stratification, the association still was significant only for men. The same kind of association was found for maternal smoking during childhood and multiple sclerosis, always among Norwegians, while regarding paternal smoking during childhood, we found an association among Canadians, even if the association was not statistically significant after the adjustment. Finally, among Italians, there was no association between parental smoking and multiple sclerosis. So, as you can see, we found a high variability between our studied populations. We overall suggest that parental smoking may increase the risk for multiple sclerosis, as in a Norwegian population we found a really strong association. And this kind of association could be explained by the developmental origin of health and disease theory, which suggests the existence of a transgenerational transmission of the risk from maternal and paternal lines to the offspring. The risk is determined during the prenatal phase, the intrauterine phase, by environmental exposures, but also genetic and epigenetic factors. And this may suggest that the prenatal exposures may be as important as early life exposures for multiple sclerosis. For the explanation of the high variability, we hypothesize that other factors could be involved in determining the MS risk. And for example, environmental factors, but also genetic factors. In our Italian populations, we hypothesized that the genetic factors could have exerted a prominent role and masquerade the potential effect of parental smoking, because most of our subjects came from Sardinia, which is an Italian region with a very high incidence and prevalence of multiple sclerosis due to genetic predisposition. Another interesting point is that the geographical region may affect the quality and quantity of the environmental exposures, not just sunlight exposure, but also the exposure to the so-called old friends, which represent the set of microorganisms to which humans have been exposed throughout evolution. the immune system to properly develop during life needs to be challenged, in particular in the early life stages. And in some cases, the improved hygienic standard and small family size reduce the contact with the microorganisms during childhood, thus contributing to deregulate the immune system development, which may react against self-antigens and predisposing to the developing of autoimmune diseases such as multiple sclerosis. So there is a complex interplay between the environmental exposures and genetic factors, which could probably explain the high variability we found between our study populations. We are planning to study more deeply the relation, the potential exposure happening during the preconceptional and the prenatal phases, which could affect the health status of children and maybe the risk for multiple sclerosis, because the possibility to prevent multiple sclerosis with prenatal interventions is very important and could lead to the implementation of public health strategies.